What happened to Amir was a very, very, very traumatic scenario. Two situations. One was a traumatic brain injury. He actually was diving into a pool, hit his head, and then fell in this pool as he hit his head on the edge and drowned. Unfortunately, suffered such a traumatic blow and near drowning experience that set him back in this scenario.
The number one thing is to give him his life back. I didn't keep him, intubated and, facilitated to have him lay on a bed for the rest of his life. That wasn't my plan.
On that first day, he brought the son here, had no movement, had no form of communication, and started therapy here at the facility.
They said he'd either get better on his own or but most likely he'd be like this in a vegetative state for the rest of his life or get worse and die. We were destroyed. We were devastated. Since he's had hyperbarics, since he's been treated with hyperbarics, he's been seeing a lot of recovery. He did not develop the seizures that were supposed to come with the injury. He also has been reversing a lot of the injury and seeing a lot of recovery. He has developmental toys that we bought for him that he showed no interest in prior to diving. Now he's able to work with all of them.
The doctors in the hospital, they said that this was a permanent injury and unfortunately would probably continue to digress and get worse.
My son has anoxic and he's been going in one direction only. Like he exploded, When I got up to 5 days a week and he did 40 dives, he exploded with recovery. He began to hold a conversation, hold it. Like he could talk back and forth with you and converse and make total sense from not being able to talk. It totally works. And prior to that, he was getting worse. He's walking back in the room, so to speak. And as I've been treating Amir, I've seen many people go from not talking, not doing nothing. I've seen older people that had dementia, hadn't talked in 7 years, talk and walk again. We've seen so much recovery. He hasn't went this way or slipped in the other direction. He hasn't been back. When he goes to see his neurologist, first thing she asks, has he been back to the doctor? How many times has he seen the doctor? And we say none. She say, oh my God, all my other patients, they're in and out of the hospital. And this medicine does work. It totally works.
Amir arrived at the hospital in a state that the physicians noted as no recovery. They said he would never leave the hospital and he would never breathe on his own, all of which he's already done.